Is everybody set? Everybody happy? Okay. Good morning, everyone. Thanks for being here today as I announce Bill 25, an act respecting the monitoring of prescriptions in the province. Bill 25 provides a legal framework for the implementation of a prescription monitoring program here in Newfoundland and Labrador. Prescription monitoring programs are being used in all jurisdictions across the country, with the exception of Quebec. The approach we're taking here focuses on inappropriate dispensing of at-risk drugs such as opioids, and it complements the approach taken by other provinces. National trends have shown an increase in opioid prescriptions. This is of concern given that opioids can lead to physical and psychological dependence, especially when used long-term to address chronic pain. The program is a crucial component needed to address prescription drug misuse and inappropriate prescribing. In addition to lowering potential adverse drug interactions for patients, the program will be designed to detect questionable prescribing or dispensing patterns and includes reporting mechanisms to address potential issues of misuse. The purpose is to help prescribers and dispensers, people like pharmacists, physicians, nurse practitioners, to make the most informed decisions when choosing to prescribe or dispense any drug, but the focus here will be opioids. The intention of this is not to police those professionals, but rather to educate. It's to give prescribers and dispensers access to information about their patients. This will then assist them in making the best possible healthcare decisions for those patients. It will also assist in identifying patients who have an opioid dependence so that appropriate services can be put in place to assist them in the treatment and recovery. The program will go into effect as of January the 1st next. A prescription monitoring program builds on other measures taken by our government through its opioid action plan to address the issue of opioids. These measures include a new mandatory safe prescribing course for physicians, passage of Bill 55, an act respecting the secure withdrawal management for young patients, a public awareness and education program on opioids. It also focuses on harm reduction in the form of naloxone take-home kit program, naloxone pop-up tents at summer locations and festivals over the course of this last summer. Earlier this year, we launched a safe prescribing course. Newfoundland and Labrador was the first province to launch such a course. Similar to that, there's also an important education piece for healthcare professionals built in to this prescription monitoring program. For example, the program will automatically flag whether a person has visited multiple prescribers or pharmacies to get opioids. This means that pharmacists will have a stronger ability to identify unusual and often inappropriate use of a number of serious drugs. Another example is that through the prescription monitoring program, prescribers will also be able to get a clear picture of their own prescribing practices. That will give them then opportunities to improve or make changes to align with best practice and the behavior of their peer group. This monitoring program will operate in tandem with the pharmacy network to examine issues of unusual activity when prescriptions are filled. In turn, the pharmacy network is a component of the province-wide electronic health record, commonly referred to as Healthy NL. The network itself is made up of a database, real-time database of medication profiles, and it's built from prescriptions filled at all of the province's outpatient pharmacies. This last spring, all pharmacies in Newfoundland and Labrador were connected to the pharmacy network. The prescription monitoring program and this legislation builds on the success of that network. Benefits from the network are in actual fact already being realized. The Newfoundland and Labrador Centre for Health Information has advised us that there's been a decrease already in adverse drug events, a decrease in prescription errors, and a reduction in duplicate prescriptions. As part of the legislation, as of June the 30th, all prescribers will be required to review a person's complete medication history using Healthy NL before writing a prescription for an opioid. This delay in proclamation will allow the Department and the Newfoundland and Labrador Centre for Health Information the time they need to work with those few prescribers who currently don't have the technology in place to allow them to access the profile. It'll also give prescribers time to adjust their work patterns to put this into their practice. This phased-in approach is not unlike the process undertaken with respect to pharmacists' access to the pharmacy network, which went live earlier. In accordance with the legislation, dispensers will be required to record the prescription in the network so that real-time access is available to both prescribers and dispensers about the drugs. Dispensers will also be required to check a patient's profile prior to issuing the drug. The electronic database for the program will reside with the Newfoundland and Labrador Centre for Health Information. The reason for this is because the centre already manages the province's electronic health record, including the pharmacy network. So on behalf of the department, the NLCHI will be responsible for the administration of this program. In situations where there may be a professional misconduct on the part of prescribers or dispensers, the Act allows for a proactive sharing of information with regulatory bodies for investigation purposes. In the event of such activities, there's a number of options the Department and the Newfoundland and Labrador Centre will have. These include further educational activities or just information sharing with the prescriber or dispenser. The prescriber or dispenser could be asked to clarify the prescription in question, explain it if you like. Information on the prescriber or a dispenser could also be provided in certain cases to the appropriate regulatory body, or information on the prescriber, dispenser, or patient may be provided to law enforcement under exceptional circumstances. Officials in my department have consulted extensively with stakeholders on the development of the program and this bill. Provincial healthcare regulatory bodies, law enforcement, community groups, and professional associations have all been consulted, and their input has helped inform the development of the program and the drafting of this bill. And I'd like to take this opportunity to thank them for their contribution. The prescription monitoring program is seen as an important step in addressing the opioid situation in our province. The objective of the program, once again, is to educate, assist and support in the use and prescribing and dispensing of monitored drugs. It's not meant to be punitive. It aims to achieve an increase in the quality of patient care, greater confidence when prescribing and dispensing opioids, and greater efficiency and coordination of care. We all have to recognize that prescription drug misuse, especially opioids, is actually a real issue in this province, one that impacts the lives of Newfoundlanders and Labradorians every day. It's going to take a collective effort on behalf of the provincial government, the public, and frontline healthcare professionals to make headway in reducing and addressing this serious public health issue. We acknowledge also that the program has taken some time to develop, and again I'd like to thank all of those who put their thoughts in and supported the process and the bill. Their commitment to improving the provision of healthcare services has to be commended, and I'd like to take this opportunity to do that once again.